Now let's look at how do we classify the plasma cell disorders. There are various classification schemes present for the classification of the plasma cell disorders. Some go into the unnecessary details, but for the matter of simplification, let's just start off by starting from the number one step. The most simple abnormality is designated as monoclonal gammopathy of undetermined significance, or abbreviated as MGUS. As the name indicates, it is basically a non-significant entity. You can say that this is a precursor to the more serious abnormality, which is the multiple myeloma. If you break down the first term, monoclonal gammopathy, there are various ways of describing the plasma cell disorders. They are also termed as plasma cell dyscrasias, the paraproteinemias, or the monoclonal gammopathies, because there is a monoclonal increase of the gamma globulins. Gammopathies means an increase in the gamma globulins, and in MGUS it is of undetermined sequence or an established sequence, because there is no physical abnormality noted with the MGUS presence. But MGUS can be classified as a precursor disease following to the multiple myeloma, which is the main or the major type of plasma cell disorders. Patients who are diagnosed with MGUS have a 1% yearly chance of transforming into the multiple myeloma. Multiple myeloma is a multifaceted disease. It has a lot of clinical presentations, a lot of clinical significance regarding the labs and its presentation and its treatment. We are going to talk about multiple myeloma in a separate lecture because it requires a lot of details and a lot of clinical explanation. We are going to talk about the other types of plasma cell disorders in this lecture, specifically the different types of amyloidosis, like the light chain amyloidosis. There are some types of plasmacytomas, which are solitary lesions. These can be these solitary lesions being helpful, as they can be eradicated with the help of radiotherapy. And then certain other entities which are closely related to the multiple myeloma but have certain classical features which distinguish them from the other types of plasma cell disorders, like the Waldenstrom macroglobulinemia. It is very closely related to the other plasma disorders but has certain classical features which makes it a different entity altogether. And to finally round it off, we have certain types of heavy chain diseases in which there is an abnormal presentation of just the heavy chains, not the light chains of the immunoglobulins. So these are the major 5 or 6 types of types of disorders which fall under the umbrella of the plasma cell disorders.